Welcome, dear viewers, to our format Natural Medicine. Today we are talking about a phenomenon that is becoming more and more frequent, macular degeneration. I am very happy that I can talk to Professor Dr. Rao about the different therapy options, including those that were successful in the past and where there may be ways to implement them. Stay tuned. Hello, dear Thomas. It's great to have you back. I have to say that I have had macular degeneration in my friends' circles. But I am also hearing more and more of this diagnosis that it is occurring. And I think, oh my, it used to be something very rare. What do you think about this? What kind of disease is it, if a viewer has never heard of it? When did it occur in your patient circle?
I am not an eye doctor, but I have to say that we have had very good success with macular degeneration. There are two forms, the moist, inflammatory, and the dry, much more frequent. So now about 5 to 1 or 4 to 1. The dry is much more frequent. This is a degeneration, a chronic breakdown of the retina cells. The retina, where you can see, so if I look at you now, then I need my spot where the central part of the eye is. This is the organ where most cells in humans are per square millimeter. So that's an insane cell density at this point. And these cells are also they are even very well circulated. So on the level of circulation, but it can also be on the level of nerve cells, can be the problem. The circulation induced is the moist, that on the nerve cell is the dry macular degeneration. Every eye doctor can differentiate this by his techniques. And also treat. With the moist macular degeneration, we don't do that. There is the laser therapy, which has extremely good results. So you can feel free to contact me. I have such addresses. We don't do it ourselves. What I do is the macular degeneration of older people. They are generally so. Yes, it starts today with 50 upwards. It used to be a suffering of the old man, where the vision power simply went down. And then the macular degeneration really got a scare in ophthalmology or also of the old man. Within 2 years the eyesight was gone. And then they really only saw so close. The macula, this central vision spot, then just broke. How do I even come to this topic? I'm a biologically medical internist, actually. How do it get to the point of treating macular degeneration? First, because there is nothing smart about school medicine. All the injections that are made into the eye by the ophthalmologists, they have, excuse me if I say it like that, above all a pecuniary financial effect. They are insanely expensive and unfortunately they don't work. So I have a good friend, the ophthalmologist, who tells me, yes, you know, this is now my source of income. Not so many surgeries are done today, and there are so many ophthalmologists. We no longer have these operations. So macular degeneration is becoming more and more frequent. That's where I do my injections. Unfortunately, these monoclonal antibodies don't work. They are not so right, chemically speaking, or not at all. So, once again, I was thinking, yes, degeneration, why is this degeneration of these cells so fast? Yes, because they are very close together, are very sensitive, because they have to take in these eyes, these visual stimuli, and then you have to feed them. And they are all renewing in humans. That fills me with joy. Everything in humans is recovering, regenerating. We are constantly changing. What can I do to make these macular cells regenerate faster? You just have to feed them well. How do you feed them? With these complex substances. These are all the vitamins, these are the highly qualified oils. Nerve cells need a lot of fatty acids to function. For example, alpha liposaccharides are one of them. Or the DHA, the omega-3 fatty acids, which you have to replace. That's how you feed the nerve cells. Then they degenerate less quickly. And you can, and that was the case in the Central European area, a wonderful therapy, the so-called fresh cell therapy. The fresh cell therapy that I did very intensively, also for other degenerative diseases. So you have cells of animal origin, so they were from piglets, they are the best. You have these cells, these so-called stem cells, but they are not stem cells, they were juvenile cells that you took. The piglet has to 96% the same genes as the human being, so it was right. Also all the peptids that were in it, you took them, the fresh cell therapy. Professor Nyhans and so on, he was very successful.
I also had a colleague who was so happy with it and then it was just stopped.
Exactly, that was first limited. The labs had to be very highly qualified. There were only 3 labs in Germany that did that at all. And that was never the case in Switzerland. Production was no longer allowed anymore. And then other techniques were made and at some point it was just stopped. For some reason, there were certainly other interests behind it. Because we had all the years, I did this for many years, thousands of patients, we never had a side effect.
That was probably the problem. That was meant ironic.
Yes, I don't want to polarize it, that's not good. But we just had very good results. It was then looked at and there were people like Dr. Rebecca Zerbel, the popius of these cell therapies, the modern ones. And then they looked at it further and looked at what was in these fresh cells. And then they made extracts. Fresh cell extracts or whole cell extracts. That was a filtering process where you only took these organ-specific peptids, which are the eye or the nerve cells or the thyroid or the adrenals, depending on which organ you took. These organopeptids were then filtered out. A technically highly qualified process. And we then had quite a lot of experience in this organ peptid therapy. This is our fresh cell therapy that we still do. Fortunately, I still have one of these. This is also the Heal company, even the company Sanem, which is still allowed to produce certain of these peptids and are still on the market. I still have such preparations. Unfortunately, we do not yet know how it will continue. But these are certainly just official restrictions that were made. In other words, we gave all substances to people who need this eye, these nerve cells of the macula.
Dem Menschen gegeben, welche eben dieses Auge, diese Nervenzellen der Makula benötigen.
And I have several cases, I could really prove this, often with analog findings. Then such a magnetic resonance examination is done, where you can see the thickness of the macula. And I have several cases that have improved. I can practically say with everyone, with our therapy it is stabilized, not downhill, as it would normally go. In 2 or 3 years, people have generally been practically blind. My patients are not. But now comes the next one. There is a technique that comes from acupuncture. There are also clinics and other doctors in Germany who do this. These periocular injections. We also do ganglion injections. It does not hurt for the people who are watching. These are the smallest injections that we do there. And at these acupuncture points, we can activate the metabolism of the eye. So we do this peptide therapy, we do the acupuncture, we give all the nutrients that the eye needs, the highly concentrated vitamins and lipids that we give, and amino acids. And so the process of degeneration can be stopped or even reversed.
Is there a certain stage for patients where you say, "Oh, that's so advanced"?
Yes. So whoever comes to me practically blind doesn't have such good prospects. I really have to say that. That's why, if you got this diagnosis from your ophthalmologist, people go to the ophthalmologist. That's right too, then, and very few ophthalmologists well versed in this therapy. So then look for someone who does this holistic macular degeneration therapy or contact us. So, because we have really good results, several, including ophthalmologists, could be amazed.
If young people, with whom this is now, so as I said, I just heard it now, oh, the neighbor suddenly got macular degeneration at 40, where I think, what's the holistic approach there? Or do you see that too? Or was that just a coincidence?
Yes, so that's not a coincidence. I see, and ophthalmologists say that too, who just have the courage to admit that in the last 2 or 3 years these immune degenerative processes have become much more frequent. I had 2 younger people, so younger, that's about 45 and the other 52, I think, who suddenly had a fast progressing macular degeneration and came to us quickly fortunately. But all autoimmune diseases, I don't want to go back to this stupid COVID topic, so stupid, that's just a very difficult topic. All autoimmune diseases have changed significantly in the last few years and have increased in frequency. And it is assumed that macular degeneration has an autoimmune character, an autoimmune background.
Are there also possibilities to work on a holistic level in the body again? If you, of course, say, blood circulation and metabolism in the eye, but that you also look at it on a holistic level on another level, where there may be toxic stress or what, why does the body start working against itself?
Exactly, why does the body start working against itself? Because the substance is changed that would allow its genetic information to be renewed.
Die ihm erlauben würden, sich immer schön zu erneuern, verändert wird.
That's why we're against all these genetic influences and see their problems.
Einflussnahmen und sehen deren Probleme.
That's one thing. And the second is because the toxic stress has increased massively. And nerve cells are very sensitive to toxic influences. Yes, but we get the toxic influences first from the gut, second from the food, thirdly because of the nonsensical antibiotic therapies that are always given to people. Antibiotics or antifungal agents are given to people for literally nothing. Yes, against the wrong bacteria. The only thing that's stupid is that it's also against the good bacteria. And the good bacteria in the gut, healthy human, the good bacteria in the gut, they would detoxify us. And the wrong ones, they produce toxic substances, like, for example, Clostridium. Clostridium produces toxins, they are neurotoxins. We don't have more nerve cells per square millimeter than in the eye. That's what works there. And that's why you're absolutely right. I'm a biological doctor and I always treat all people. You have to rebuild people in their environment, in their inner environment. And the gut and the liver are the most important. Interestingly, in Chinese medicine, I know quite well, the liver and the eye belong together. The liver and the eye is the sensory organ of the liver. In the Chinese medicine, they are not stupid, it has developed over 3,000 years, in billions of people. So this is really a scientifically proven medicine, simply through the huge experience. The liver and the eye belong together. If the liver is toxic, the eye is weakened.
So can I start with a liver detox?
Exactly, the liver detox is good for everyone. It builds up the liver's vital forces, the energy of the human body.
When I think of the eye, I always think of the microcirculation problem, when the blood changes in consistency. You have more experience with that. What happens to the blood? Does it also have an influence on the subject?
Yes, I think it's so common now. I think it's even recognized in school medicine that COVID and the immunization treatments around COVID, which have been done very often, can make a change in the blood platelets.
Covid und auch die Immunisierungsbehandlungen Covid herum, die halt eben sehr häufig gemacht wurden, eine Veränderung der Thrombozyten, der Blutplättchen machen kann.
This complication, with the still a little unclear complications, around the COVID immunization, but what is best recognized or discussed the most, is the change in microcirculation.
Die Covid-Immunisierung herum, aber was mittlerweile am besten anerkannt ist oder auch am meisten diskutiert, ist die Veränderung der Mikrozirkulation.
Can I, when I'm affected now, and I know how my blood is, let me check my blood value, to see if there is a damage or not?
Yes, we are now on a different topic. There is no blood test which would show the macular degeneration. But there is the test of unsaturated fatty acids, or the fatty acid profiles. There is the examination of vitamins and the good and bad fats in the body. This has a direct influence on the eye. There are many antibody tests where you can see if eye-damaging viruses are present. There are also cross-reactions. The clarification of such things, especially the macular degeneration, is on the one hand to see how the condition is, to the eye doctor, but also the whole clarification of the causes, that is in the hands of a truly versed biological doctor.
die ganze Abklärung für die Ursachen, die gehört in die Hand eines wirklich versierten biologischen Arztes.
Because he looks at
Schaut
it.
darauf.
Yes, I found it super helpful, especially nice that you continue to care for your patients with these already successful methods. That is of course worth gold, especially that you learn about it. If you want to read into it, want to inform yourself, or just want to know from you, how can it go on? If we have viewers who already have such an extreme, advanced condition, to clarify again, does it still make sense to me or not?
That's very difficult. You shouldn't wait until it's advanced. I understand the advanced, almost blind people, but they are of course in fear. These are often older people. Come early. We can help you. The already completely macular degenerated people, their redevelopment at an age of 65 onwards, that is difficult. We know causes. We can really help. Get in touch with us if you are such cases. Unfortunately, there is not much literature, especially about this peptide therapy, the further development of fresh cell therapies. A large portion of our success is due to the fact that we can give these peptides. Or the PRGF therapy, that's another one, where you concentrate blood platelets and from there the growth factors wins. These are the methods, highly specialized methods, that we use. You can contact us. My clinic or our clinic has the www.biomed-sonnenberg.com, that's our address.
BioMed-Sonnenberg, weil es halt eben sonniger Berg ist. Sonnenberg.com, das ist unsere Adresse.
Super.
Biomed-sonnenberg.com, you can check it out.
Thank you very much, Thomas, that you were here today. Even if it's a special topic, I think it's important. It's more upwards with the patients than downwards. Thank you and see you soon.
With pleasure.
Dear viewers, it's nice that we have doctors who really treat these special diseases in a holistic way, and who can also create successful regenerations for the patient. Thank you and see you soon. Bye.